adverse effects of the NSAIDs, and the side effects are very prominent in the first generation NSAIDs, especially the first generation NSAIDs, whereas it is less common in case of the selective COX inhibitors. COX inhibitors. The many types, the earlier these NSAIDs, they have got many side effects, whereas the modern NSAIDs do have very less side effect. And apart from this one, they cause the blood loss in stools and cause the gastric ulceration, of course. Gastric ulceration, and of course, so the nausea, vomiting, and sometimes the epigastric distress, and the occult blood test, that is the test in blood in the feces will come. The most important adverse effect is gastric mucosal damage. The reason being is the gastric mucosal protection is mediated by COX-1, means it is going to produce PGI2 and PGE2, and these two enzymes are responsible for the secretion of the bicarbonate ions, secretion of the mucin, and also the maintenance of the mucous membrane. So because of this thing, they have got the gastroprotective activity, whereas the earlier NSAIDs like the aspirin and other drugs are going to inhibit the COX-1 enzyme, and hence there will be less secretion of the gastric bicarbonate ions, and also the this mucin production will be drastically decreased. Hence, there is a formation of ulcers and erosions in the stomach. Especially the dogs are very sensitive to this thing, apart from the human being. Of course, the cattle which are suffering from the diseases like filaria, anaplasma, etc., they are highly susceptible to the NSAID toxicity. So many times the hypersensitivity and the idiosyncrasy is also seen. Hypersensitivity and idiosyncrasy are also very common clinical sign. Very commonly they are all noted, and we can find the sometimes, especially in case of cats, they are also very commonly susceptible. Cats, many times the owners, they themselves will administer the NSAIDs and come up with the toxicity, and that's also one of the important reason for the toxicity. Apart from this one, the horses are also susceptible to the greater extent, especially they are also susceptible to the gastric erosion, and apart from that gastric erosion, the other signs are also very important. The side effects, especially the non-steroidal anti-inflammatory agents, then yeah, of course this is yes, sir. The dizziness, drowsiness, tinnitus, vertigo, reversible impairment of the balance, etc., are somehow important, especially in the non-steroidal anti-inflammatory agents, the toxicity is concerned. Whereas the many times the most common side effect is the gastric disturbance. And here you can see the system affected and the adverse effect reactions. The gastrointestinal system is very much affected. So the gastroesophageal reflex is affected. There will be erosions, peptic ulcers, gastrointestinal hemorrhage, small and large bowel ulcerations are formed. Whereas there is a characteristic ulcer formation even in the therapeutic dose also in cattle. If you administer the NSAIDs like diclofenac sodium, then maybe the aspirin and any other drugs like the phenylbutazone, etc., they are causing severe punched out ulcers even at the therapeutic dose also. They are highly susceptible, and hemopoietic system, there will be impaired blood clotting, impaired platelet activity, then the blood dyskaryosis is also present, then bone marrow dyskaryosis is a very common feature of NSAID toxicity. Especially the renal tubular nephritis is also a common thing. Then renal capillary, papillary necrosis and acute renal failure will be seen in case of the, especially in case of birds, they are highly toxic. Especially the diclofenac is a toxic drug to the vultures. Because of this thing, diclofenac is banned in India because of the vulture episodes, and others are hepatotoxicity. It is causing that particular hepatotoxicity also, then aseptic meningitis, the diarrhea, and the depression, and many more type of the clinical signs. And as the aspirin, of course, it's a prototypic drug, and aspirin and congeners in the therapy of the children with rheumatoid arthritis is found to raise serum transaminases enzymes, especially including the SGOT or AST and ALT. These enzymes are, they will be increased. And but most of the cases are asymptomatic, and the liver damage is not so significant, and it is reversible also. An association have been noted between salicylate therapy and Reye's syndrome. This is one of the syndrome. It's a rare form of the hepatic encephalopathy seen in children having viral infection. So the virus are varicella and influenza. So this is a rare form of the hepatic encephalopathy seen in children having viral diseases. So in adults also, long-term therapy of aspirin at high doses can cause incidence onset of hepatic injury. And apart from this one, salt and water retention occurs in a dose-related or dose-dependent manner. As the dose increases, the water retention increases in the body. And there is one term called as the acute salicylate poisoning. It is more common in the young ones, especially in case of the children. And the fatal dose in adults is estimated to be 15 to 30 grams. So this is also a very high dose. Sometimes what happens is, if the tablet of the aspirin is kept open, many times the kid may consume it. Then this type of the toxicity may occur, and but it is considerably lower in children. Serious toxicity is seen at serum salicylate levels more than 50 milligram per deciliter. However, the incidence is rare, but you can note the clinical signs of the toxicity like vomiting, dehydration, electrolyte imbalance, then acidotic breathing, and hyperglycemia. Of course, the petechial hemorrhages, restlessness, delirium, hallucination, and also the ulcers, coma, and finally there will be a death due to the respiratory failure or the cardiovascular collapse is seen. It's a common phenomenon. Then you may ask the question, what is the line of a treatment? As such, there is no specific treatment for the NSAID toxicity is concerned, but the treatment is totally symptomatic. Most important is the cooling, that's IV fluid with the various sodium, potassium, and bicarbonate and glucose, or the multi-mineral content should be there, and according to the need or electrolyte balance should be done. So the gastric lavage is also another important step to be taken in case of the human beings and the dogs, whereas it is very impossible in case of the large animals, especially in case of ruminants. Gastric lavaging is not possible, but sometimes ruminectomy may also be indicated. We can use the gastric pump. A pipe will be inserted in the rumen and the contents are taken out. That method also can be performed. So alkaline diuresis or hemodialysis is also another one of the method to remove absorbed drug and indicated in the severe cases. And blood transfusion and vitamin K supplementation is always necessary because there is a lot of bleeding from the stomach and also the intestines because of the ulcerogenic nature of the aspirin and other drugs, NSAIDs. Next, the propionic acid derivatives. The classical example is ibuprofen. It is the first member of this class to be introduced in 1969 as a better tolerated alternative to aspirin. Of course, many others are also being followed. Many other drugs are there and all have similar pharmacodynamic properties. Of course, all the NSAIDs do have the similar pharmacodynamic property, means the mechanism of action, but they differ considerably in potency and also to the extent of some of the pharmacokinetic actions like the duration of action, then the absorption, distribution and excretion patterns. So this is also somehow important while we are considering the individual drug. The analgesic-antipyretic and anti-inflammatory activity is rated somewhat lower than high dose of the aspirin. So it's very similar, especially the ibuprofen. All members inhibit PG synthesis, naproxen being the most potent. So in vitro potency to inhibit COX does not closely relate to the in vivo anti-inflammatory property. And here you can see the propionic acid derivatives. The examples are the ibuprofen, the naproxen, the ketoprofen, then ketoprofen, and many more drugs. Yeah, the naproxen and the ibuprofen are very commonly used, whereas the ketoprofen is a very specific drug used in veterinary practice. And ibuprofen, it is used in the dental surgery or any other induced pain, and the dosage varies from 400 to 600 milligram total dose in case of the human beings. Or else if you take the per kg dose, it is 5 to 10 milligram per kg. And the naproxen acts 12 to 16 hours, that's the DHOP, whereas the dose is 250 milligram BID or twice a day, and many trade names are there. And ketoprofen, it's a short acting one, but it is very potent anti-inflammatory activity is there, and hence very commonly used in the treatment of the joint pains in case of the horses and cattle. Please remember that ketoprofen is commonly used approved drug in case of the veterinary and is used in the treatment of joint ills, pain. And carbipropane is also another drug used in human beings. 4 to 6 hours it is going to act, and total dose in case of the a man weighing about 70 kg is 50 milligram. So then the adverse effects are very similar to that of the other drugs, but they are better tolerated than aspirin. Aspirin is one of the oldest drug, but till it is used in the human practice to what you call as the treat the myocardial ischemia. And the side effects are milder and their incidence is, of course, it is lower. And gastric discomfort, nausea, then vomiting is also seen, which is very common thing in case of all the NSAIDs except the COX-2 inhibitors. And of course, this is the indomethacin, less than indomethacin, and the are still most common side effects are gastric discomfort. So always whenever the NSAIDs are given, the pantoprazole, a proton pump inhibitor, is always administered. The physicians, if you go to a physician now, take any drug, or if NSAIDs are prescribed, apart from that only COX-2 inhibitors. So if they are prescribed by the physician, definitely they are going to prescribe a course of the proton pump inhibitors or H2 receptor antagonists like ranitidine, famotidine, etc. So this is the very common side effect, especially the COX-1 inhibitors have got the more and more side effects when compared to the COX-2. But as we go on to the COX-2, the anti-inflammatory activity is going to be reduced, because the leukotrienes are not inhibited there. Whereas in case of COX-1, if you inhibit, then the leukotrienes are inhibited, which are the potent inflammatory mediators. And gastric erosion and occult blood means the digested blood which is coming in the feces, and the feces color turns a black. That means it is a melena case. So they are not to be prescribed to pregnant women and should be avoided in peptic ulcer patient because it passes the blood placental barrier, enters the child, and there it may cause the gastric erosions, and also the there is a chance that it may cause some of the deformities, especially in case of the offsprings. And the pharmacokinetic property is very same to that of the general NSAIDs, the PP. One of the important thing is the plasma protein binding is very high here, 90 to 99%, but displacement interactions are not clinically significant, means the dose of oral anticoagulants and oral hypoglycemic need not be altered. So there is a competition between two drugs, especially the NSAIDs and also the anticoagulants and oral hypoglycemic drugs. They are going to displace, and such action is not seen in case of these particular agents are concerned. And because they inhibit the platelet function, use with anticoagulants should nevertheless be avoided. It should be avoided because they may increase the bleeding time, or bleeding may be increased if it is due to the ulcer or any type of the diseases or hemorrhages. And NSAIDs, they are other NSAIDs, they are likely to decrease the duration of antihypertensive action of the thiazides, furosemides, and the beta blockers. And the clinical use of these drugs is the ibuprofen is used as a simple analgesia and antipyretic in the same way as low dose of the aspirin. So it is very specifically effective in the dysmenorrhea, in the action is clearly due to the PG synthesis issues. So then in addition it decreases the production of IgM or immunoglobulin M, rheumatoid factor, and leukocyte chemotaxis. So this can inhibit inflammation in diverse different ways. So the attraction of the inflammatory molecules to the place of inflammation is reduced by Piroxicam. That's why it is an analgesic, anti-inflammatory, and the antipyretic in nature. Coming to the pharmacokinetic of these agents, it is rapidly and completely absorbed as usual, just like the 99% of the plasma protein bound and largely metabolized in liver by hydroxylation and also the glucuronide conjugation. So excreted in urine and bile, both enterohepatic circulation occurs because it is secreted in the bile. And plasma T half is long, nearly that's the 2 days it is going to act, especially the Piroxicam. And steady state concentrations are achieved in a week, and single daily administration is sufficient, usually Piroxicam. And adverse effects, as usual, it is very common that the GI side effects are more than ibuprofen, means it is potent GI ulcerogenic agent, but it is better tolerated and less ulcerogenic than the indomethacin and causes less fecal blood loss than aspirin. So aspirin is always causing the fecal blood loss. The rashes and pruritus are seen in less than 1% of the patients, but serious skin reactions may be possible, and edema and reversible azotemia are commonly seen, especially the clinical signs of the ulcers and erosions are also very common here. And the clinical uses of these agents, especially the Piroxicam and meloxicam and so many other drugs which are under this category of the enolic acid derivatives. So, due to the slow onset of the action, it is suitable for the use as long-term anti-inflammatory drug in rheumatoid and osteoarthritis or ankylosing spondylitis. So, it is not the first choice drug when any other condition because relatively it is more toxic. It has also been used in the acute gout, then musculoskeletal injuries, and the dentistry. So usually the surgeons who operate on the bones, etc., they will always prescribe such type of the drugs which are in which there is a pain due to the bone origin. Then these drugs are little potent. And the next class is acetic acid derivatives. The classical example is ketorolac. And this aryl acetic acid has the potent analgesic but modest anti-inflammatory activity. Then in case of the post-operative pain, it has been equaled the efficacy of the morphine. See, that's morphine is one of the strongest post-operative pain-killing drug, whereas it is replacing this ketorolac is going to replace the morphine, but it does not interact with opioid receptors and is free of the opioid side effects. Okay, then the other NSAID is it inhibits the prostaglandin synthesis and relieves the pain primarily by a peripheral mechanism, not by the central mechanism. Of course, the morphines and opioids, they induce the painlessness in case of the central action. So in short-lasting pain, it has compared favorably with that of the aspirin, very similar to that of the aspirin. So ketorolac is rapidly absorbed at oral and intramuscular administration, and it is highly plasma protein bound, and 60% is excreted in urine. And why we should learn all these things, you may ask the question, but this is very important when you are going to use two drugs simultaneously. Suppose you are using the drug, one is called as the blood thinner and also the ketorolac. Then the blood thinning capacity of the drug will increase, which may increase the bleeding time. Hence, we should know the pharmacokinetic property, the dynamic property, both in a proper manner. And we have to compare with that of the other drugs, especially other drugs of the same class, because if there are very other good drugs, then we can select. And adverse effects, the nausea, abdominal pain, dyspepsia, ulceration, loose stools. Yes, this is also very common. After administration of NSAIDs, especially in case of the thaliariasis, the next day the animal starts what you call as the loose stools, avoiding the loose stools, because the secretion in the intestine is increased, and there is a little drowsiness, especially headache in case of human beings. Then so many times you will get the dizziness and nervousness, and also pruritus and pain at injection site. Ketorolac, there will be a pain. Of course, many of the NSAIDs are having the oily preparations and cause lot of pain at the site of injection. And ketorolac has been used concurrently with morphine to keep its dose low. Maybe the morphine dose can be reduced to greater extent. However, it should not be given or administered to patients on anticoagulants. So many times what happens, the ketorolac and some of the blood thinners or anticoagulants or heparin may be administered simultaneously, and this increases the bleeding time, and also more and more clotting time is reduced. Clotting time is increased, hence it increases the bleeding from the ulcers or erosions. So this should be avoided in such patients. And the clinical use of the ketorolac it is frequently used in post-operative dental and acute musculoskeletal pain. So this also can be used in case of renal colic, and also due to the pain due to the bony metastasis. Many times the cancer is spread to the bones, and it is also known as the metastasis, and at that time there is a lot of pain is caused, and at that time the ketorolac is a drug that can be prescribed. And the next drug in this category is indomethacin. So this is a indole acetic acid derivative and is a potent anti-inflammatory agent with prompt antipyretic action. That means it is a drug with antipyretic action and the anti-inflammatory action, but maybe less analgesic property. Indomethacin relieves only inflammatory or tissue injury pain. Please remember that indomethacin relieves only inflammatory or tissue injury related pain. So it is a highly potent inhibitor of prostaglandin synthesis and suppresses neutrophil motility also. And in case of the toxic doses, it encapsulates the oxidative phosphorylation, just like aspirin. It's also going to do the toxicity. And the pharmacokinetic property of the indomethacin is it is very well absorbed from the oral, and also the rectal absorption is there, but it is slow but dependable. And it is 90% bound to the plasma proteins, then partly metabolized in the liver to inactive products and excreted by the kidney as urine. And the plasma half-life of the indomethacin is just 2 to 5 hours. The pain will be reduced to 2 to 5 hours. And the adverse effects, there is very high incidence of the gastrointestinal and also the central nervous system side effects. Then this is produced and the gastric irritation, nausea, anorexia, gastric bleeding and diarrhea are the very prominent clinical signs of this drug after toxicity. Then there is a term known as the frontal headache. This is a very common type of the headache in case of the human beings, and in such case the dizziness, ataxia, mental confusion, hallucination and all the depression and psychosis are there. At that time the drug need to be withdrawn. And high incidence up to 50% of the gastrointestinal and CNS side effects are produced. Most of the NSAIDs always produce the gastric side effect, and also few of the NSAIDs are going to cause the central nervous system side effects. And it is applicable to the indomethacin, and it is contraindicated in machinery operators, those who are driving, those who are using the machine, or always with the what you call as the mobility tools, and also the drivers, psychiatric patients, epileptics, and kidney diseases, pregnant and women and children. This drug is not indicated. And because of the prominent effects, indomethacin is used as a reserve drug in the conditions requiring potent anti-inflammatory action like ankylosing spondylitis, acute exacerbations of the destructive arthropathies and psoriatic arthritis, and also in malignancy associated with fever, refractory to the other antipyretics may respond to the indomethacin. And there is one syndrome known as the Bartter syndrome. So this syndrome responds dramatically as it does to the other PAG synthesis inhibitor. See, what's a Bartter syndrome? So it is a genetic disorder in which there are specific defects in kidney function, and these defects impair the kidney's ability to reabsorb salt and causes imbalances in the varieties of the electrolyte and fluid concentration in the body. So the Bartter disease syndrome is one of the syndrome which is due to the genetic disorder, which there will be a very specific defect in the kidney function, and these defects impair the kidney's capacity to reabsorb salt and water imbalance in case of human beings. And in such situation, or Bartter's disease, the mechanism is of course unknown. The administration of the indomethacin gives a drastic recovery. And the next class is the pyrazolone. And the example is the antipyrin, or it's also called as the phenazone, and amidopyrin or aminopyrin, as used as the antipyretic and analgesic drugs. Their use was associated with the high incidence of agranulocytosis. High incidence of agranulocytosis. And of course, this both phenazone and imidopyrin, they are banned globally, and phenylbutazone and its active metabolite oxyphenbutazone were also the marketed. And the antipyrin and imidopyrin both are not used because of their potent side effects. Of course, their potency may be more, but they cause lot of side effects. Hence, if you weigh for the benefit and risk ratio, the risk will be more. Hence, it is they are not commonly used, but they are the two potent anti-inflammatory drugs, inhibit the COX, but have slow onset, weak analgesic and antipyretic action. Whereas there, as usual, the gastric toxicity is very, very high. Edema due to sodium and water retention is frequent, and CNS side effects, hypersensitivity reaction, hypothyroidism are also reported. And they have gone out of the use due to the residual effect of risk of bone marrow depression and other toxicities. And two other pyrazoles available in India are metibenzole and the profenazone. These are two other pyrazolons and are used as an analgesic and antipyretic. Of course, in veterinary use, the phenylbutazone is used in case of horses in many situations which are causing the pain and inflammations. Whereas the preferential COX-2 inhibitors are the another class of the NSAIDs, and this NSAID is a relatively weak inhibitor of the PG synthesis, and they are the moderately COX-2 selective agent. The nimesulide, meloxicam, diclofenac, and all these drugs are preferential COX-2 inhibitor. Please see that the preferential means their preference is more towards COX-2, but they are also acting on the COX-1 enzyme. Hence, they have got the classical toxicity of gastrointestinal erosion, whereas they are the very potent anti-inflammatory agents. So the anti-inflammatory action may be exerted by other mechanisms as well, because the reduced generation of the superoxide by the neutrophils, inhibition of platelet acting factor synthesis, and tumor necrosis factor alpha release, and also the pre-radical scavenging mechanism and inhibition of the metalloproteinase activity in the cartilage. Of course, the cartilage-induced pain is very tough to reduce, whereas the nimesulide is one of the very good agent which we can use it for many type of the bone-induced pains. The analgesic, antipyretic, and anti-inflammatory activity of nimesulide has been rated compared to the other NSAIDs only, and it has been used primarily in short-lasting painful inflammatory conditions like sports injuries. So if you are a runner, then run for a long time and get some of the injuries like the joint injuries, etc. Then if you use the nimesulide, it is going to completely relieve the pain and sinusitis and other nose and throat disorders. And of course, in case of the dental surgeries, the nimesulide is very commonly used. And of course, the bursitis, low dysmenorrhea, post-operative pain, and osteoarthritis, and also the fever induced may be due to so many reasons. The fever may be induced by the bacterial origin, more and more viral origins, and many more. Of course, the protozoal inhibition induced conditions like anaplasmosis, babesiosis, and also the thaliariosis, and early HOCs in case of the dog. and nemucellide is almost completely absorbed orally, then 99% is plasma protein bound, then extensively metabolized in the liver and mainly excreted through urine with T half of the 2 to 5 hours. It is going to act to the extent of 2 hours up to 5 hours. We can see the effect. And yes, this is one of the classical drug which is banned in veterinary practice due to the vulture episode. What's a vulture episode? So in Pakistan, it is observed that the cattle which are treated with diclofenac sodium and die, maybe due to the unresponsive to treatment. Then if the cadaver is consumed by the vultures suffer from a characteristic neurological disorder, their neck is twisted and they die due to the respiratory problem. So it inhibits PG synthesis and somewhat it's a COX-2 selective. Diclofenac is COX-2 selective, even though COX-1 activity is very much more, but they have got very specific COX-2 selective because the anti-inflammatory activity is more pronounced by the analgesic activity and antipyretic activity. The diclofenac, and it has a good tissue penetrability and the concentration in synovial fluid is maintained for 3 times longer period than the plasma, and it exerts the extended therapeutic action, especially in case of the joint illness. So it is withdrawn from the veterinary market in during this recent years. Veterinary market, as it is caused the paralysis, especially in case of the vultures. Of course, the surrogate models like poultry, pigeons, and the other birds are also used as a surrogate models. Surrogate means similar models of this particular toxicity, and many of the drugs like indomethacin, the ketorolac, diclofenac sodium, piroxicam, meloxicam, all these drugs are screened for the toxicity, whereas diclofenac was proved to be very highly toxic in case of the avian species. If you given a question like dash is a drug withdrawn from the veterinary market because of its vulture episodes or vulture paralysis is the diclofenac. And also if you take another question like the dash is a drug which is withdrawn from the market for the severe ulcerogenic effect, it is diclofenac. So even though it has got many advantages, but there is a chance of the lot of toxicity. Then meloxicam is one of the most important drug which is very commonly used in case of the veterinary practice. It selectively inhibits the cyclooxygenase 2, that's COX-2 enzyme. Please read this very carefully because meloxicam is one of the most commonly used NSAID in veterinary practice. So it is a preferential cyclooxygenase 2 enzyme inhibitor and reduces the pain and inflammation by inhibiting the synthesis of the PGs or prostaglandins. It is a very effective anti-inflammatory analgesic, generally free of the gastrointestinal side effects when compared to the other NSAIDs. Of course, it is a very common drug which is approved for the use in case of the veterinary practice and also in the food producing animals. Meloxicam is used to decrease pain, inflammation, and also as an antipyretic, and it has been used for the acute and chronic treatment of the pain and inflammation in the dogs and cats. In pigs, meloxicam is very effective for the mastitis metritis agalaxia or MMA syndrome. In case of pigs, it is effective for the treatment of MMA. What is MMA? Mastitis metritis agalaxia syndrome. Of course, in horses, meloxicam is effective for treating pain and inflammation associated with the surgeries. And meloxicam is also used as extra label in many exotic and zoo animals, including the reptiles, the birds, for the treatment of varieties of the inflammation. So what is a extra label drug? So the extra label drug is the one which is supposed not to be used in another species, but the doses and other things are not well established in XYZ species, but still we are using them. That's the extra label. So the drug is not labeled for the use of the meloxicam in XYZ disease, in XYZ animal, but it is used and the efficacy is broad. So this is known as the extra label use. The dose of this drug, just simply remember that whenever you are using the meloxicam, 1 milligram per kg body weight, or what you call as the 100 milligram per 100 kg body weight. And the another drug of this preferential COX-2 inhibitors is etodolac. This newer indole acetic acid in NSAID is moderately COX-2 selective in properties similar to that of the diclofenac sodium. At lower doses, gastric tolerance is better than the older drugs. NSAIDs. It is metabolized by the hydroxylation and glucuronide conjugation and excreted in the urine with a T-half of about 7 hours. The etodolac is going to act till 7 hours. And post-operative analgesia with etodolac lasts for 6 to 8 hours. See, whenever we are using the etodolac after surgery, we need not dose it repeatedly. Once in 12 hours, that's enough, and the side effects are very common to that of the other NSAIDs: abdominal pain, the omission, gastric ulceration, and many more. Of course, it is used as osteo and rheumatoid arthritis as well as in the acute musculoskeletal pain. Suppose you are a sports person and after the jogging and running and severe muscular pain is there, then etodolac is a classical agent which cures very fastly. Whereas if you take the aspirin and other thing, they are not so good anti-inflammatory agents. And now we will deal about the COX-2 selective inhibitors, or they are also known as COXIBs. Please remember, the specific or selective COX-2 inhibitors are called as the COXIBs, and they cause less gastric or mucosal damage and occurrence of the peptic ulcers. Because of the rampant occurrence of the peptic ulcers, the scientists gave an importance to the production of the selective COX-2 inhibitors. And another thing is, ulcer bleeding is clearly lower when compared to the other preferential COX-2 inhibitors and older drugs. And they do not depress thromboxinase 2 production by the platelets, whereas it is the TXA2 is a COX-1 dependent. That means they are not so having the very good analgesic anti-inflammatory property. They but reduce PGI2 production by the vascular endothelium, and the selective COX-2 inhibitors are also called as COXIBs, and there are the three examples are celecoxib, etoricoxib, and pericoxib. So they are available in India for the human use. Of course, the drugs need to have a trial in veterinary practice is concerned, and rofecoxib and valdoxib were withdrawn within few years of marketing because they were causing the cardiovascular risk. So if you are asked the question like why rofecoxib and validocoxib were withdrawn from the market, is they were going to cause the cardiovascular risks. And lumiracoxib, marketed in Europe, has been suspended due to the severe hepatotoxicity. So even though the selective COX-2 inhibitors are not causing any gastric problem, they are causing some other problem like the kidney toxicity and also cardiac toxicity. And the selective COX-2 inhibitor should be used only in parents at very high risk of the peptic ulcers and perforation and bleeding. So if selected, they should be administered in lower dose or the shortest period of the time. And generally what we think is the COX-2 inhibitors are safe. Not like that. They are going to cause the other organ injury apart from the GI tract. Maybe the liver injury, maybe the kidney injury, or also the injury to the cardiac tissue or cardiotoxicity. And they should not be used to be avoided in the patients with the history of ischemic heart disease, hypertension, cardiac failure, cerebrovascular disease, who are predisposed to the cardiovascular events. And in the patients with any type of the cardiac disorders, the COX-2 inhibitors like celecoxib, heterocoxib, etc. should not be used. Even though they are very good anti-inflammatory analgesic agents. And the combination of low-dose aspirin with COX-2 inhibitors for reducing cardiovascular risk increases gastroduodenal injury and it is advised. So this should not be combined with the aspirin. And one of the classical agent of this category is a celecoxib. The COX-2 selectivity of the celecoxib is modest and similar to that of the other drugs. It exerts anti-inflammatory, analgesic, antipyretic actions with that of the very low anti-ulcerogenic potential. So it is effective as naproxen and diclofenac without affecting the COX-1 effectivity in case of the gastroduodenal mucosa. And platelet aggregation in response to the collagen exposure remained intact with the celecoxib recipients, and the serum thromboxane B2 levels were not reduced. So it is better tolerated than the traditional NSAIDs till abdominal pain, dyspepsia, and other things are also the common side effects. And celecoxib is available as 200 milligram capsules and a human preparation. Of course, the veterinary treatments are not there. The another drug is heterocoxib, and this newer COX-2 inhibitor has the highest COX-2 selectivity, and it is suitable for once a day treatment of the osteoarthritic pain or gout, and all other properties are very similar to the celecoxib. And the T half is more, that is more than 24 hours. And the rate of the thrombotic cardiac events in heterocoxib has been found similar to that of the diclofenac. So it should be considered as treatment of option only as per contraindications conditions started above for COX-2 inhibitors. Wherever there is a severe gastric problem is there, then only these drugs need to be used. And here the heterocoxib tablets are available as the 90 milligram tablets in the particular blisters. And the para-aminophenol derivatives are the last class in this particular NSAIDs. That's the paracetamol or acetaminophen, one of the most commonly used drug, the deethylated active metabolite of the phenacetin. And paracetamol is a very popular and drug, but it can cause the toxic or fatal in case of the small animals like the cats and dogs. And dogs are less sensitive to the paracetamol when compared to the cats. And a 20 kg dog would need ingest over 7 500 milligram tablets in order to suffer the toxicities. In lower doses, they are not toxic, but sometimes the owners are going to purchase these paracetamol tablets and administer it to cats. And cats are, of course, should not be administered with any type of the paracetamol. And it raises the pain threshold, but has a weak peripheral anti-inflammatory component. Yeah, associated with low gastrointestinal side effects than the regular NSAIDs, and not associated with the renal toxicity, especially paracetamol. And here the nimesulide and paracetamol is a combination available in the veterinary practice. And the treatment, paracetamol has very negligible anti-inflammatory action and is a poor inhibitor of the prostaglandin synthesis in peripheral tissue, but more active on the COX in the brain. So, because of this thing, it is very commonly used as a antipyretic agent. The ability of the paracetamol to inhibit COX-3, another enzyme, is also observed, and the paracetamol does not stimulate respiration or affect acid-base balances and does not increase cellular metabolism. So that's about the what you call as